Case manager here at TMC. Good afternoon, Megan. Good morning.
Hi, thanks for having me.
Thanks for being with us. And explain what a case manager does here at the hospital.
I'm a nurse case manager, and I work with social worker Jessica, along with other social workers and nurses in the hospital, to make sure that patients have a safe discharge plan and that the parents are equipped to care for their child.
Because we're in a situation where insurance is kind of confusing and it gets a little spotty. And in a case like this at a community hospital, we try to look past the insurance, correct?
We do. We do, but we have to help the family find resources within their means, their circle that they have, or provide them with community resources to help them.
And how does the money raised from Children's Medical Network affect your job?
We use the money in a very different way. Where you've been hearing about the money being used for equipment here at the hospital, we end up having to use the money for, say, prescription assistance. A family, especially of a new diabetic that comes in without insurance, their prescription initial bill is somewhere between $350 and $400. That we provide them with those resources so that they can leave them, they have a plan to safely get the medication for their child. We also use it for possibly equipment they may need. We use it for things like providing or establishing phone service for them so that they're able to call 911 for their child.
Wow.
Turn utilities back on so they're able to plug in their equipment for their children, heat hot water for them, things like that. We're finding that with the change in the economic environment, we have a lot more need.
Yes, we hear from the Community Food Bank that the hunger rate is much higher. It's far more higher than we ever thought it would be in Tucson, and that people are living in poverty and they don't have the basic needs and the utilities. So I never really considered that would be something that you would be looking into.
It is. It's what we look at with every child, and what's becoming more upsetting to us, worrisome to us as providers are the families that have insurance. You know, maybe like you or I, but they suddenly run into having a very critically ill child that they need to provide care for, and they have a $40 copay for every medicine. They leave the hospital with 8 medicines. You know, that's cutting $300 out of your monthly budget. Can you do that? You know, those are families with insurance that maybe just can't do that, can't sustain $50 copays for doctor's offices.
And you did mention the economic situation, people finding themselves in dire financial straits, and they never even thought or considered that they would be there.
Exactly. We also run into the problems of making sure that our parents are able to go to work, or that we provide some sort of I don't want to say excuse, but some sort of letter to their employers saying that they were here so they don't lose their jobs. Right.
Well, Megan, it's pretty incredible work you're doing there, and thank you very much. And it's good to know where the money from Children's Medical Network, where that's going to. A lot of the devil's in the details, I guess is what they say.
Well, 623-5437, that's the number to call, and this really is about, coming together as a community.